In America, childbirth is not always a joyous occasion. It can be perilous, especially for Black women. They face alarming rates of pregnancy-related complications. This crisis is driven by deep-seated inequalities. We must confront this with unwavering resolve. The lives of Black mothers and their babies hang in the balance. The roots of this crisis run deep, entangled with a long history of systemic racism that continues to permeate American society. This racism manifests in various forms, from implicit biases in healthcare settings to discriminatory policies that limit access to quality care for Black communities. Implicit bias, often unconscious and unintentional, can lead healthcare providers to make different assumptions about Black patients. Their pain might be underestimated, their symptoms dismissed, and their concerns ignored. This can result in delayed diagnoses, inadequate treatment, and ultimately, tragic outcomes. Beyond individual biases, systemic racism shapes the very fabric of our healthcare system. Residential segregation, driven by decades of discriminatory housing policies, confines many Black communities to areas with limited access to quality hospitals, obstetricians, and essential prenatal care. The chronic stress of living in a society that devalues Black lives takes a toll on the physical and mental well-being of Black women. This stress, coupled with limited access to quality health care, creates a perfect storm for adverse pregnancy outcomes. Access to quality health care is not a privilege, it is a fundamental right. Yet, for many Black women, it remains an elusive promise. The barriers are multifaceted and interconnected, creating a web of obstacles that hinder their ability to receive equitable and respectful care. Financial constraints play a significant role. Black women are disproportionately affected by poverty due to systemic economic disparities. Lack of insurance or underinsurance can make essential prenatal care, regular checkups, and crucial postpartum support inaccessible. Transportation barriers add another layer of complexity. In many underserved communities, reliable transportation to distant hospitals or clinics is scarce. This forces expectant mothers to delay or forego essential appointments, jeopardizing their health and that of their unborn children. Even when Black women can access healthcare facilities, they often face a system ill-equipped to meet their unique needs. Cultural sensitivity training for healthcare providers is often lacking, leading to misunderstandings, miscommunications, and a sense of distrust between patients and providers. Section 4. The weight of inequality. The consequences of these disparities extend far beyond individual tragedies. They ripple through families, communities, and generations, perpetuating a cycle of inequality that is difficult to break. Maternal mortality leaves a void that is impossible to fill. Children lose their mothers, families are torn apart, and communities grieve the loss of their loved ones. The emotional and psychological toll on children who lose their mothers at birth or in early childhood is immeasurable. Beyond the immediate impact, maternal mortality has far-reaching economic consequences. Families lose primary caregivers, impacting their financial stability. The loss of potential earning power due to maternal deaths represents a significant loss for the economy as a whole. Addressing this crisis requires a comprehensive approach that tackles the root causes of these disparities. We need policy changes that prioritize equitable access to healthcare, invest in underserved communities, and dismantle the structures that perpetuate systemic racism. Section 5. A call for action, saving mothers, saving lives. This is not an unsolvable problem. We have the knowledge, the resources, and the moral imperative to act. Saving the lives of Black mothers and ensuring equitable maternal health outcomes require a collective effort from policymakers, healthcare providers, and communities alike. Expanding Medicaid coverage postpartum is a crucial step towards providing continuous care for new mothers. Ensuring access to affordable housing, nutritious food, and safe neighborhoods can alleviate the stress and improve the overall well-being of expectant mothers. Investing in culturally competent healthcare providers who understand the unique needs and experiences of Black women is essential. Diversifying the healthcare workforce to better reflect the communities they serve can help bridge cultural divides and foster trust. This is not merely a matter of healthcare, it is a matter of human rights. Every mother deserves to bring her child into the world safely, regardless of the color of her skin. We must demand better, do better, and create a future where motherhood is not a potential death sentence, but a time of joy, anticipation, and hope. And